Hello all, I am Dr. Vibhash Vaidya and today in this video we'll discuss about the venous drainage of the upper limb. The veins draining the upper limb are divided into two groups. One is superficial vein and another is deep veins. Here in this picture we can see this light blue structures are the superficial vein, and the other hand deep to this light blue structure we have a deep blue structure which are the deep veins. Superficial vein which are easily accessible. Here in this picture we can see this superficial vein which are very easily accessible, and it used for the drawing the blood samples, it used for the giving the intravenous injection. Now the deep veins, as we know, the deep veins which lies deep to the muscles, and it accompany the artery as the veiny committents. Now first we'll discuss about the superficial veins of the upper limb. As we know, the superficial veins lies in superficial fascia. Here in this picture we can also appreciate just beneath to this skin we can see this light blue structure are the superficial veins, and it have a tendency to run away from the pressure sites, so it absent in palm, ulnar side of the foramen and the back of the elbow, and the superficial vein accompanied by the cutaneous nerves. The two major superficial veins are, first is cephalic vein which lies the preaxial border of the upper limb, and the basilic vein which lies the postaxial border of the upper limb. Here this arrow shows the cephalic vein and the other arrow which shows the basilic vein. The superficial veins comprises of the dorsal venous arches, the cephalic vein, the basilic vein, and the medial cubital vein. So first we'll discuss about the dorsal venous arch. Here this picture which shows the dorsal venous arch, and this dorsal venous arches is a network of the veins on the dorsum of the hand. The dorsal venous arches which lies 2 to 3 cm proximal to the heads of the metacarpals. Here we have the metacarpals, and from the 2 to 3 cm proximal to the heads of the metacarpals we can appreciate here a networks of the vein which is known as the dorsal venous arch. The dorsal venous arch drains into the cephalic and the basilic vein. Here we can see this is the cephalic vein and this is the basilic vein. It forms the major venous drainage of the hand. Now the tributaries of the dorsal venous arch. So first tributaries is the 3 dorsal metacarpal vein. Here we can see these are the 3 dorsal metacarpal veins. Then the dorsal digital vein from the medial side of the little finger. Here this is the dorsal digital vein. Then the dorsal digital vein from the lateral side of the index finger. This is the dorsal digital vein which lies the lateral side of the index finger. Then 2 dorsal digital veins of the thumb. Here we can appreciate over here 2 dorsal digital veins which lies in the region of the thumb, and the veins draining the palm and the hand. So these are the tributaries of the dorsal venous arch. Now the applied anatomy of the dorsal venous arch. The pressure on the palm during the gripping. It does not hamper the venous return of the palm. Then it rather facilitates the returns as the venous blood from the palm is draining into the dorsal venous arch via veins of the palm. Now the cephalic vein. As we know, the cephalic vein lies in the preaxial border of the upper limb, and it begins as a continuation of the lateral end of the dorsal venous arch. Here we can see it begins as the continuation of the lateral end of the dorsal venous arch. It crosses the roof of the anatomical snub box. Here we can appreciate, here this is the side of the anatomical snub box. It ascends on the radial border of the forearm. Then it continues along the lateral border of the bicep brachii. Here we can see it continues as a lateral border of the bicep brachii muscle and runs in the deltopectoral groove. This is the deltopectoral groove, and it pierces the clavipectoral fascia. This is the clavipectoral fascia which pierced by this cephalic vein, and finally it drains into the axillary vein. Then at the elbow, blood from the cephalic vein stunted into the basilic vein through this medial cubital vein, and it accompanied by lateral cutaneous nerve of the forearm. This is the lateral cutaneous nerve of the forearm. Now the basilic vein. As we know, the basilic vein which lies the post-axial border of the upper limb, it begins as a continuation of the medial end of the dorsal venous arch of the hand. Here we can see it begins from this medial end of this dorsal venous arches. It runs upward along the medial border of the forearm. Here we can see it runs along with the medial border of the forearm. Then it continues upward in front of the elbow along the medial side here. Then in the middle of the arm, it pierces deep fascia and unite with the brachial vein. Here we can see it pierces the deep fascia and unite with this brachial vein. Then it continues as the axillary vein at the lower border of the teres major muscle, about 2.5 cm above to the medial epicondyle of the humerus. It joined by the medial cubital vein. Here we can see the basilic vein which joined with this medial cubital vein. Then it accompanied by the medial cutaneous nerve of the forearm. Here we can see this is the medial cutaneous nerve of the forearm. It corresponds to the short saphenous vein of the lower limb. So this is all about the course of the basilic vein. Then the medial cubital vein. Here we can see this is the medial cubital vein which lies in between the cephalic and the basilic vein. The medial cubital vein is a communicating vein between the cephalic and the basilic veins. It shunts the blood from the cephalic veins to the basilic vein. It's seen in the front of the cubital fossa. Here we can see this is the medial cubital vein and this is the cubital fossa. The medial cubital vein begins from the cephalic vein 2.5 centimeter below the elbow band. Here we can see from here the medial cubital vein begins. Then it runs obliquely upward and the medially to end in the basilic vein 2.5 centimeter above to the bend of the elbow joint. It received the median vein of the forearm. Here we can see this is the median vein of the forearm. Now the median vein of the forearm. Here we can see this is the median vein of the forearm and it begins from the palmar venous network. Here we can see this is the palmar venous network. It runs in the anterior midline of the forearm, ends in any one of three veins: cephalic, basilic and the medial cubital vein. Sometimes it bifurcates into the median cephalic, medial basilic veins to join the cephalic basilic veins respectively. Now the common venous pattern in the front of the elbow. The veins in the front of the elbow commonly forms two patterns. One is H pattern and another is M pattern. This is the H pattern and this is the M shape pattern. Now the medial cubital vein, which separates from the brachial artery by the bicipital aponeurosis. Here we can see this is the medial cubital vein which separated from the brachial artery by the bicipital aponeurosis. It communicates with the deep veins through a perforator veins which pierces the bicipital aponeurosis. So it used in the venipuncture. Now the venipuncture in the cubital fossa. These veins used for giving the intravenous injections and the withdrawing the blood. The medial cubital vein is most preferred because it is most superficial vein in the body and easy access, and it well supported by the underlying bicipital aponeurosis, and it well anchored by the perforator so does not slip during the procedure. Now the clinical anatomy of the basilic vein. The basilic vein used for the cardiac catheterization, as the diameter increases as the ascent from the cubital fossa to the axillary vein, and it direct line with the axillary vein. The catheter passes in the succession as the basilic vein, then the axillary vein, then the subclavian vein, then the brachycephalic vein, then the superior vena cava and the right atrium of the heart. Then the cephalic vein, which prefer for the hemodialysis in the chronic renal failure patients, and it used for the superior vena cava infusion by the cutting down in the deltopectoral groove, and it joined the axillary vein at the right angle. The cephalic vein, which difficult to maneuver catheter around the sharp cephaloaxillary angle, so not preferred for the cardiac catheterization. Here this is the real cadaveric picture which shows the cephalic vein. Thank you for watching.